That's Democratic Governor of New York, Kathy Hochul, on Msnbc last night, saying she would stand down on a potential push for redistricting in New York if Texas does as well. Let's bring in right now Republican Congressman Mike Lawler of New York. He's a member of the Foreign Affairs and Financial Services Committee. Congressman, thank you so much for being with us. We're going to get to that in a second, but we've been talking about the problems that Republicans have had because of the so-called Big Beautiful Bill, which could also be called the bad budget-busting, debt-laden piece of garbage. Either way, 6 of one, half dozen of the other, I suppose. I'm wondering, how are the hospitals in your district going to manage with all the cuts to Medicaid that are going to be coming up? Because it's obviously, some of them have already said it's going to impact them.
Well, respectfully, Joe, Medicaid is going to grow by over 24% over the next 10 years. What we focused on in the bill was rooting out the waste, fraud, and abuse within the system. Medicaid has more than doubled over the last 5 years in overall cost. And when you look at a state like New York that spends 83% more on Medicaid than the average of the other 49 states, that's a pretty expansive program. So this whole notion that is being fostered by Democrats like Kathy Hochul, throwing out ridiculous numbers about who's going to lose coverage or the impact on hospitals in New York, the fact is it's bunk. You look at the overall system in New York. New York has had serious challenges because of the mismanagement of its state by people like Kathy Hochul. New York State spending has increased by $100 billion in just one decade. So when you're talking about debt, when you're talking about budget busting, that's exactly what the problem is in New York. It's why New York leads the nation in out-migration. We simply made common sense reforms, making sure that illegal immigrants are not collecting Medicaid benefits. In New York, they are spending billions of dollars on illegal immigrants. So very quickly, you could adjust and move those billions of dollars to fortify the hospitals and the healthcare system in New York. Secondarily, work requirements for able-bodied adults without dependent children. That's something that you championed in the 90s, Joe, as part of welfare reform when you were in the House Republican majority. So these are common sense reforms. I have no problem defending it and articulating it.
Well, respectfully, Mike, the Congressional Budget Office, which obviously is a part of the institution where you serve, says that there's going to be about $900 billion to $1 trillion in Medicaid cuts. If you look at the hospitals in your own district, Montefiore Nyack Hospital is already saying, because of that vote, because of these cuts, they're going to have to cut back services. They're going to have to cut staff. They're going to have to cut care. Same thing with Westchester Hospital. Hospitals across your district are going to have to cut services and care and staff members and budgets because of your vote and because of this bill that passes. That's what they're saying. It's not some left-wing focus group or some. Well, I'm just telling you what they've said, so
what they're parroting is the same talking points being put out by the state and by the hospital association. So they're parroting. You know their business better than you know their business better than they know their business. Congressman, you can keep talking if you want to, but are you saying that they know, you know their business, you know doctors' business, you know hospital administrators' business better than they know their own business? Is that what you're telling us here? No, Joe. If you'd stop putting words in my mouth and let me answer the question. Number one,
you said they were parroting. You said that actually they were having the words put into their mouth. You said they were parroting other people's words.
Go look what they've actually put out, and it's all the same. It's all the same points that the Greater New York Hospital Association and that the state of New York are parroting. But the bottom line is, and I've met with all of them, they have had significant challenges because of the way the state has managed the Medicaid system in New York. Montefiore Nyack is a safety net hospital. 85% of its funding comes from Medicaid and Medicare reimbursements. The state has cut them off for years, refusing to give them the funding that they need through various programs, and instead telling them, go to your parent, Montefiore Health System, based out of the Bronx. So we can get into the challenges that Montefiore Nyack or Westchester Medical Center are facing. Many of them stem from the fact that the state has mismanaged its Medicaid system for years. Okay, so I'm more than happy to have that discussion. I've had it with the CEOs of both Montefiore Nyack and Westchester Medical. We fought in this bill to help Westchester Medical with respect to state-directed payments because the state failed to submit the state-directed payment in time. So I was able to secure a change within the bill to help them.
You're saying then, again, and I'm not putting words in your mouth, you say they're just parroting other people's words. They don't really know what they're talking about when they're talking about how your vote hurt their hospitals, that it's actually Kathy Hochul's fault. Is that the bottom line before we get on to redistricting?
What I'm saying, Joe, is they're all parroting the same line from the state of New York and Greater New York Hospital Association. But when you actually drill down on the specifics, many of the challenges that our hospital systems in New York have faced actually stem from the decisions made by New York State over the past few years.